my community, girls were using herbs, local drugs, and omo. Some could even insert sticks in their reproductive systems to carry out abortions, and that is what we call unsafe abortion.
Girls were really suffering during abortion because they were taking the local herbs, which endangers their life. Some girls were dying.
Before the project, for sure, the community had a lot of stigma about post-abortion care services. Initially, when I went there, the services were not offered. Right from the health workers, they were fearing to offer the services. They used to refer these mothers to other facilities.
I am a lead VHT, Nagongera Town Council, Health Center 4, Nagongera. The work I do with TDYAN is post-abortion care.
Post-abortion care is a life-saving or supportive health care that is offered to girls or young women who have had an abortion. It can either be spontaneous or an induced abortion.
My name is Eric Okello. I am happy to talk about a project that we are partnering with IPAS to implement in Tororo District. The project is on advancing post-abortion care to reduce maternal mortality as a result of unsafe abortion. Now, this project is implemented in Tororo in partnership with the District Health Office. And for us, it's very important because we have seen very many girls dying as a result of unsafe abortion. We are very grateful to IPAS for the support we have received in Tororo District to do a number of things. And what are we doing as TDYAN? We are having conversations that matter. We are talking about stigma in our communities. How do we address the problem of stigma to allow girls and young women access post-abortion care services in our communities? We have seen the dangers of stigma, the danger of people accessing services in secrecy, but also accessing unsafe services from TBAs or traditional birth attendants, or maybe from people who are unqualified to provide professional care. So as TDYAN, to popularize the fact that PAC services are available from level 3, level 4, and level 5 health facilities.
We are working closely with health workers, cultural leaders, religious leaders, peer educators, VHTs, and other local structures that are in those communities. What has been our entry point in these discussions while engaging with these stakeholders? Our most effective entry point has been on youth-led drama, particularly the forum theater piece entitled Behind Closed Doors, A Girl's Cry for Help. This production piece was created by young people, produced by young people, and it has been used in 7 health facilities. It dramatizes stigma, misinformation, and system failure around unsafe abortion. This production has always been used as an entry point to these conversations. In all our community dialogues, we have played this production to our participants, and after the performance or after watching the film, we engage our participants in questions like, who is responsible for this girl's death? What other choices did this girl have? What would the community have done differently to save this kind of girl? As TDYAN, we come on board to say no to stigma around PAC services, because PAC services are services that save lives.
The VHTs and the peers were trained, and they created awareness to them. So these peers and the VHTs went down to the ground and started creating awareness to the community members, whereby even the religious leaders, the cultural leaders were involved, so the community is aware about the services, and it is now acceptable in Sopsok sub-county. The support from TDYAN and IPAS, they came on the ground, they trained the health workers, they changed the health workers' attitudes. So the health workers started having a positive attitude towards providing the services, And now the community is also aware about the services, and the services are now being offered to them at a free cost. I feel the services are more convenient and comfortable to the community. The mothers are no longer going to other facilities. They are no longer going to the TBS. They are no longer using the local hubs. They are now coming to the facility. And the VHTs are doing their work. They are referring these mothers to the facility.
Because there is even a scenario whereby a girl of 15 years took 10 drugs and the kid died in her stomach. She had no solution except she was going to die, but the health workers provided the girl with the service and we saved the life of that young girl.
TDYAN should come to the villages to sensitize the community about abortion, and even to take the drama group in the village. It will really help.